And staying with health issues, it's emerged that public hospitals in Uganda have run out of essential medicines and supplies needed to carry out emergency operations. The Uganda Medical Association says these shortages are affecting mainly pregnant mothers who urgently need to undergo surgical procedures. Here's CGTN's Isabel Nakirya with more.
It's been a difficult 3 days for Maria Nacheng. Her patient was admitted to the emergency ward of the National Referral Hospital in Uganda's capital, Kampala. But despite his condition, getting immediate treatment wasn't easy.
But he couldn't be put on the list that day. There were a lot of people to go through the surgery, so he was rescheduled for the next day. But even for the next day, we waited until he was worked on at about 1:30 a.m. the next day, the night. And his condition was getting worse and worse and worse. And we had to request for oxygen, which also took us a while to get.
The patient underwent surgery to remove an inflammation in his stomach and is now recovering, but accessing drugs is still a problem.
Yeah, so we had to buy more gloves, more painkiller, tramadol injections, because he was complaining of pain. Then we bought them. When we bought them, they told us the nurse will come. It took hours for the nurse to come around to administer the drugs.
Her patient is among thousands in Uganda who are not able to receive essential drugs from the country's public hospitals because of a shortage. The Uganda Medical Association says pregnant mothers in need of emergency care are at risk.
In fact, one of the mothers came in late at 3 a.m. at night, whereby she was not able to go out to private pharmacies and buy these medicines and supplies. And she unfortunately lost her baby.
The Health Ministry attributes the problem to poor coordination between the government agency responsible for supplying drugs and the health facilities, which they say is being rectified. It's not new that public hospitals are running out of essential supplies. Medical workers have routinely complained of lack of medicines and essential supplies, and these are some of the reasons why doctors go on strike quite often. But the country's health budget is also not enough. This financial year, the government allocated only $600 million to health care.
It's true these hospitals have run out of supplies. So where there are no supplies, there is really nothing much that the hospitals can do. But you should also know and understand that government drugs, the funds available to the national medical stores can only procure about 48% of the total drug requirements for our health facilities. So the other 52% people need to chip in.
Most private hospitals in Uganda are not affordable for the largely poor population. They access treatment from public facilities, which are in most cases poorly equipped. And for now, patients will have to hang in there, hoping the situation improves. Isabel, Nakirya, CGTN, Kampala.